Never has something so small been so significant to so many. And at the moment, effective COVID-19 vaccines aren't so easy to get hold of. Analytics firm Airfinity estimates over 1 billion doses have been made since the pandemic began. Pfizer-BioNTech, Oxford AstraZeneca and China's Sinovac are leading the production. China's created more vaccines than any other nation, ahead of the US, European Union and India. Now to the part concerning many health experts, where vaccines are being sent. Simply, developed nations are mostly well served, developing nations aren't. Africa perfectly illustrates this imbalance. There are around 1.2 billion people living in Africa. The whole continent has administered just 17.5 million doses, so less than 2% of the population have had a shot. India, which is experiencing an incredible surge in infections at the moment, has administered the third most vaccine doses of any nation. But that equates to around 10% of the population receiving a shot, so less than 3% of the population there have been fully vaccinated. Compare this to the US, where more than 40% of adults are fully vaccinated, and the UK, where around half the population have had at least one shot. Though Australia is lagging behind in terms of doses administered per capita, with less than 3 million doses administered so far. Now, epidemiologists are concerned nations with a severe shortage of vaccines may become hotbeds for COVID mutations. And as we've seen, mutated viruses can spread easily beyond borders and infect those already vaccinated.
If you have a lot of people becoming infected, you've got a lot of viral replication happening in those countries. And it's that viral replication that increases your chances of seeing new variants that might be more dangerous for us. They might cause more serious illness, or they might spread more easily, and worse, they might do both. They could also escape the current vaccines that we have in hand. So it's really important that we do address infection risk across the whole planet.
This is indeed a global fight requiring global cooperation.